The coronavirus pandemic struck developing economies at a time when they had already been struggling with unsustainable debt burdens for many years, as well as with rising health and economic needs. Due to deteriorating fiscal positions and heightened public debt vulnerabilities, Sub-Saharan African governments are struggling to find room to deploy fiscal policy to address the COVID-19 crisis. Zimbabwe, amongst other developing economies, is not exempted. As the financial turmoil from the global crisis continues, the country has experienced sharp currency devaluations, making debt servicing more strenuous. Join various CSOs from Zimbabwe as they give their voices on the impacts of COVID-19 on the debt sustainability in Africa and Zimbabwe in particular.
When looking at COVID-19 and debt sustainability for Africa and also for Zimbabwe, it is very key and critical. And I've been in conversations where we have been talking about how we're going to get out of the current debt distress and debt burden as a country and as a nation, because COVID-19 has brought with it a lot of pressures for our governments to curb or combat the effects of COVID-19. It requires resources. And prior to COVID-19, as a nation, Zimbabwe is already in debt distress, and this debt was already above the normally recommended thresholds. Zimbabwe's debt sustainability, or the measurement, is normally based on debt to gross domestic product, GDP, and Zimbabwe's debt was already in the regions of 75%, which is way higher than the regional threshold of 60%. And for institutions such as the IMF, they indicate that if a debt threshold is above 60%, then that becomes uncomfortable. What it means is, in times of disasters and in times of need where the government has to broaden its fiscal space, there are going to be challenges that will lead to debt unsustainability. So as the government looks for resources to combat the pandemic, it means it's going to have budget deficits. When the national budget was done, we were not anticipating that we'll have this pandemic. So definitely there is an issue of budget deficits, and the government has to finance that, and it has to use different market instruments, and one of them is the issue of debt. It could be external, it could be domestic, but we know externally Zimbabwe has not been getting much in terms from the international financial institutions because of our debt standing. At the regional level as well, many countries in the SADC region have been facing either debt pressures or already in debt distress, or some in recessions like South Africa, huge debt, but it was already going through some recession according to projections. Zambia is already in debt distress, Mozambique is already in debt distress, Angola is facing the same. So quite a number of countries were already facing challenges. And from the information and studies that we have and assessments that we have, most of the SADC countries, if we look, they have not been keeping within the SADC threshold of 60% to debt sustainability. But a lot of loans have been extended to many African countries, so to speak, grants and loans, though concessional. So it means that is going to raise the debt stock. So in the end, in as much as we're giving debt relief, there are aspects that we are likely going to see debts ballooning if we do not do something about it.
I think the world at large has been severely affected by the COVID-19 pandemic. The world has come to a standstill. Business is suffering. People's livelihoods have been destroyed. Travel bans mean that there is also less velocity in terms of doing business. So these are enchanted moments for the whole world, but obviously there are various degrees of yet depending on how strong our respective economies are. Another dimension that is so strong is the issue of the debt trap. You discover that most countries, particularly in the Sub-Saharan region, are languishing in huge debt. We have seen a response, particularly by the Bretton Woods institutions, to provide some debt relief, but that has also not been applied to other countries like Zimbabwe, South Sudan, for example, that equally need this particular debt relief for various reasons. And I think this is kind of put a dent on the ability of these countries to weather the storm associated with COVID-19. But more importantly, I think we need to draw lessons as African economies on how do we need to be prepared for such kind of disaster, and how do we need to abstain from this debt trap such that we are not found wanting during this kind of times. The best and foremost way to deal with the debt is to be able to harness our own internal resources. I believe Africa is very rich and has good capacity to generate its own resources for development needs. So what probably we need to do is to reprioritize and improve our resource governance so that we even channel resources where they are needed most.
COVID-19 pandemic came at a time when most of the Sub-Saharan African countries were facing various challenges. For Zimbabwe, it had a huge debt overhang, much of it, 70%, over 70% of it being interest on the debt. We also had challenges to do with inflation, which is now around over 1,000%. And the local currency has been devaluing, and currently in the official market is pegged at 25 to $1. But in the real market, the unofficial market, which is supplying much of the foreign currency, it is now 1:80 to the US dollars. So already the country was facing serious challenges. And the debt crisis also was a big crisis for Zimbabwe, with much of our debt composed of interest on unpaid loans, which is hovering around over 70%. So we were failing to pay our debts, and our debt has been in different forms, some of it with the IMF, World Bank, and the Paris Club group of countries, and also now with China and many other corporates and many other vehicles that are lending to Zimbabwe. So we are in a crisis, and the debt crisis has been made huge by COVID-19 because there's now competition for resources. As we focus on addressing employment, as we focus on addressing social services and health services, education, we still also have to pay our debt to various countries and institutions that we owe. And this means we are going to have more challenges in terms of repayments and incur more interest on the debt that we currently have.
COVID pandemic has made the debt situation very bad in the sense that when the economies are not performing, you find that then it limits the room for generation of money that is needed to repay the debts, and also it further pressure is put on the economy in the sense that you have got resources that are needed to channel more towards health, education, and so forth that have been disrupted very much by or strained a lot by COVID. So which also limits space in terms of the ability to be sustainable when you have got a huge debt burden that you are confronted with.
It is, of course, quite paramount and evident that due to the COVID-19 pandemic that has gripped the whole world, a lot of countries like Zimbabwe will face challenges in debt repayment, to meet their debt repayment targets, owing, of course, to the stagnation that has gripped most of our economic levers, including the productive sector. You look at mining, it stopped completely owing to the initial and the second phase of the lockdown, and as well as agricultural activities. Zimbabwe, yes, remains an agro-based economy, and in that sphere, it certainly then means that an effect or an impact on agricultural activities that sustains both subsistence and commercial, farming communities has got a paramount effect on the general economy. As you may be aware that raw materials have got to come through from the agricultural towards the manufacturing industry. And again, where you have such a global pandemic, there is a tendency for countries to look inwards. Just like we have seen, there's a lot of domestication of sustainability of production, self-sufficiency in terms of supply of key essentials. You saw a lot of countries struggling to meet the demand for essential COVID-19 products like masks, as well as testing kits, etc. So that has also probably left a huge dent in terms of the fiscal ability by countries such as Zimbabwe, a developing country, to meet its debt obligations. And it is a time that we also anticipate that the international world will also look at the inability of such countries like Zimbabwe to pay up its debts and ensure that we can also get a reprieve. And it is also anticipated that the reprieve or the money saved or the money that could actually have gone towards the repayment of debts is also directed towards revamping the health systems of the country. If you look at our health system, yes, we've covered a lot of gap in terms of the number of health institutions that are across the country, be it government hospitals, local authority clinics, as well as private players in the health sector. There has been a tremendous growth, but in terms of capacitation, there has been a huge gap in terms of the health services sector to be capacitated, access to modern equipment, and of course the catching up with the technological advancement, modernization of a lot of the equipment. We have lagged behind, of course, owing to quite a number of reasons, one of which includes accessibility of foreign currency to be able to procure such a modern equipment.
We have been highly informalized economies. What do you do to those individuals who suddenly cannot go to work, whether they are combi operators or they have been informal traders relying on importing goods and services, and now that is, with the border closing, that is no longer possible? What do you actually do? The vulnerability. Countries of the North have been able to say, we have funds that we can then say, even though you don't go to work, I can support you. Countries like Zimbabwe, who already were operating on serious deficits. Yes, we had a running surplus for a very short period of time, but with inflation, that deficit, that surplus didn't amount to much. And now you have then a huge population which is on the streets, and people that were economically productive that were on the street. What do you actually do with them? That is an evolving issue. It has not yet been adequately. There has been some money that has been put together to that. There has been some stimulus package that has been put together to that. But what it has done, this COVID, it is that it's put to test the fact that a lot of African countries, one, we had weak budgetary systems. Number two, we're highly import dependent. And then with the disrupted borders, you now need to focus on your own productivity. And then yet you are importing your maize, your soya, your wheat and everything, and those things don't grow in a month, in a week. And so how do you reorient, especially population, which is also used to getting things from out of the country, but that population doesn't have the money. So the vulnerability of African countries, Zimbabwe in particular, has been largely exposed through this COVID crisis. And worse still, Zimbabwe, with the sanctions that it is in, it has not been able to borrow from international financial institutions. What it has done is then to create an additional stimulus package from 18 billion, but without really explaining how this additional stimulus will come through and what it will do to erode the value of the local currency. So that is still a situation, and as can be seen, rates are tumbling. The local unit has lost a significant value.
So Zimbabwe, I would say it has got one of the worst actually health systems maybe on the African continent, mainly because of the misallocation and misprioritization of funding the healthcare, the public healthcare system. Citizens in Zimbabwe depend mainly on the private sector. So this is then for those that have. So those that are vulnerable and that are likely to suffer from COVID-19 and other pandemics or epidemics, and who depend on the public sector healthcare, suffer the most. I think when COVID came, we had only about 16 ventilators. Some of the hospitals that were assigned or allocated to deal with COVID had nothing, like Ekusileni in Bulawayo. That was like a white elephant without anything, and resources have to be raised for that. Wilkins, we know the shape in which it was in. So we can look at it from both the local government healthcare system and the national government health system. It has been dilapidated and run down for years. And this is, like I have indicated, mainly due to misallocation. Our leadership has decided over the years to seek for medical attention outside the country, so they never saw the need for the use of the public healthcare system. So this is why mainly we are where we are. So we left the little that was there, we left it for the donors.
As a result of many years of neglect and many years of poor governance, and also many years of bad policies, the neoliberal policies and austerity measures, our health services has been neglected for a long time. And COVID came at a particular time where we already faced serious challenges. So for example, we have a serious shortages of doctors and nurses in many hospitals. We also did not even have equipment. We didn't have drugs, and we were facing serious challenges in terms of importing various medical supplies because of the foreign currency challenges and many other challenges. You remember we also had come out of a very prolonged doctor strikes, and doctors and nurses are basically demotivated. They are not earning sufficiently for them to be motivated. So COVID has heaped more crisis on a crisis situation. If you go around our provincial hospitals, they are in bad shape. If you go to our district hospitals, some do not even have ambulances. Some lack even common drugs like paracetamol. And if you then go to the rural area clinics, those are quite neglected. Many of them, they do not even have sufficient nurses. So in terms of responding to COVID, we were found wanting. We at some point didn't have sufficient masks, sufficient protective equipment, ventilators, and now all those issues have to be acquired if we are to successfully fight COVID-19 pandemic. So we have a crisis in the health sector. There's been some response, government response, but government response has been very, very muted and sporadic. It is not well structured. In some instances, it has also opened cases of corruption, like we have witnessed in the recent past, where the government is now procuring some of the medical supplies from companies that are not reputable, companies that are linked to political players, and companies that do not have the capacity to supply government.
When this thing started, most countries, especially in Africa, were totally unprepared. Certainly Zimbabwe was not prepared in terms of just your basic infrastructure, in terms of the, for instance, the detection system. A lot of the diseases that were coming were imported at the time. And it meant at the time you just needed to have a basic screening at various port facilities. It had to take mining companies, for instance, to make sure that they put in that infrastructure at the various ports of entry for the country, to be at least have some basic level of possible screening and the like. At the time when he started, Zimbabwe didn't even have lab equipment to actually test for COVID. The first cases where you'd actually go, you'd take the specimens to South Africa. You recall the unfortunate death of the young Sororo. It was actually across the board. How he comes in, he goes to a private doctor, the private doctor does not know what it is. He goes to Wilkins, and Wilkins does not have a working ventilator. They try to get a ventilator from something, things don't work, and the young man died. That actually summarizes how we were at the time.
Our health infrastructure generally in Sub-Saharan Africa is not up to scratch. We thank God that we are not hard hit by this pandemic, and we thank God that He may continue to protect us so that we are not hard hit. Otherwise, we are going to see some horror movies in our hospital. Yet we've been hard hit at the same scale and magnitude as certain European countries. Let's look at 18 billion Zimbabwean dollars for Zimbabwe. If you multiply that by, if you divide that by the prevailing black market exchange rate, these are a few millions of dollars. What will you do? It's obviously insufficient. Actually, given that Zimbabwe was reeling from serious challenges even before the COVID-19 pandemic itself. So what it means the country is constrained, has reached some kind of plateau in terms of really generating its own resources to stimulate itself.
Generally, especially for Zimbabwe, it has been a huge disaster, with the people dying of diseases that are medieval, like cholera, and so typhoid. So you now look at the COVID situation as something that is going to make that is going to double down in terms of the poor health service delivery.
Civil society in Zimbabwe has always played that complementary role to government. So the responses have been at two levels. The first level, we have civil society organizations that have actually been intervening in terms of provisions of PPEs. So these are the ones that have provided, for example, sanitizers, masks, and the like. Then we have those that have continued to intervene under the water and sanitation. So we have civil society organizations that have been providing water, for example, to communities. So that's at that level of provisions. But we have civil society organizations as well that have been looking at the resources, because the government made pleaded with the international community, with the citizens, to come together with resources to fight COVID-19. So in this regard, our government has been receiving donations. So we have civil society organizations that have been monitoring those donations, how they are coming in, tracking that, but also trying to monitor the distribution of those resources. So in that regard, that is mainly where we have been involved as the Zimbabwe Coalition on Debt and Development, putting an eye on what we are receiving. Is it loans? Is it grants? The debt question that I've spoken about. But also looking at, are they being used prudently to benefit the most vulnerable citizens? So So we have been tracking and monitoring resource use, the resource that come in and the resources that have been used. So we have a tracker, for example, a weekly tracker where we track what the government has received and what it has drawn down from what it has received. And I know of many other organizations that have been doing the same, Magamba Network, TIZ, and the like. They have been doing this work as well. From the tracking, like I've indicated that we have been tracking resources that we have been doing in ZimCod, the government of Zimbabwe has so far received donations worth $390 million, United States dollars.
So we have a number of initiatives that have been undertaken by civil society, international community and government, but broadly these are uncoordinated, and this is resulting in many challenges. For example, resources are not going where they are needed most, and in some cases resources are not sufficient. The private players, also companies, individual philanthropists have also come in and donated in a number of areas.
For civil society, the responses have been varied, but the first thing that is important is that we were flat-footed. We were caught flat-footed when the pandemic started, but now there is significant monitoring of government public financial frameworks, and recently in Zimbabwe we've seen pressure being put by civil society for government to be more transparent and accountable, which has also exposed our government. Political, well-connected people are benefiting from inflating the costs of procurement so that they reward their cronies and so forth. Yeah, so that's the role of society.
The priorities for these resources, for us and for Zimbabwe, we believe that they are the following. We have the issue of personal protective equipment for frontliners. We have the issue of additional healthcare workers that need to be engaged, because government had frozen quite a number of posts in the Ministry of Health. We have the issue of the risk allowances and upkeep of those in the frontliners. We have the issue of testing, which is a major issue that Zimbabwe has not been testing enough. So we really don't have a clear picture in terms of the number and the rate of infections. So it's a priority in terms of the resources that we have been receiving. The other priority is on the healthcare system. Like we indicated, it was dilapidated. There was literally nothing. No ventilators, basics like plugs and stuff like that, and we know the stories. So we would want to see prioritization of the infrastructure in terms of ventilators and the like, and all the health and medical equipment that is required to take care and to treat those that may be infected.
In terms of the help, I think greatly is much appreciated, but the question is, how do you bypass poor public financial frameworks for governments that are corrupt, that are less transparent and accountable to citizens? That's the key thing. So it's about making sure that money is not paid, but also giving as much as possible the actual materials that are needed to fight against COVID.
Zimbabwe is in a catch-22 situation, not necessarily because of the corona pandemic, but because of historical circumstances, because of already existing inherent challenges that are in our economy. So I think this is a challenge that we need to deal with, fully aware that even outside the pandemic, we still have problems to deal with as a country. And this calls for concerted efforts from all stakeholders. Obviously, everything rises and falls with the leadership. So we pray that our government provides the much needed leadership so that all forces, progressive forces, rally behind sorting issues that will make us a prosperous country.
I would want to believe that this is the time actually for the government of Zimbabwe representing us as its citizens, and if they do listen to the voice of the people, as they always say, that they must look at genuine re-engagement with the international community for debt cancellation. There is no way that we're going to move forward without addressing the issue and pleading for debt cancellation or calling for debt cancellation from the international community. And there are legitimate reasons to do so. But our government has to be very sincere in terms of reforms. I think what has been withholding the easing of the debt burden in Zimbabwe has been the issue of economic reforms and political reforms. Political reforms in the name of respecting of citizens' human rights. So when the international community is engaging with Zimbabwe, the question is, will the resources that are unlocked from debt cancellation not be used to further suppress the rights of the citizens, for example? Or will they not be illicitly stolen by those that have been involved in the vortex of corruption in Zimbabwe? So we need to deal with this issue. We need to deal with the issue of the currency crisis that we currently have. If the resources that we get today come to Zimbabwe or they are unlocked at a rate of 25, the interbank rate of 25 to 1 for the Zimbabwean dollar, but we know on the black market that it's $75. Will not those that have access to it, the elites, the political elites, not take the resource at 25 and go and sell it on the black market at 75? So there are critical issues that we need to address as we deal with the issue of debt cancellation. Because we don't want leaders that are always caught with their hand in the cookie jar stealing. And I think for the international community, that must also be very clear. That Zimbabwe needs, yes, debt cancellation, but let us talk about the reforms that will ensure that the citizens of Zimbabwe can enjoy their freedoms and they can enjoy economic interchange. There are so many other ways. There is also the issue of maybe giving grants to Zimbabwe, particularly to deal with this crisis and the disaster that we are in. But as I have indicated, I think we do lack on transparency, we do lack on accountability, even if we were to get the grants, so that at least we are not extended with debts that will make our debt stock balloon even further. We could get grants. But then we have to talk about the transparency and accountability, like I have said. How are we going to deal with that issue? There is also an avenue around special drawing rights that Zimbabwe has in the past used to clear the IMF debt, for example. That is another avenue that could be used, because we don't have to go and borrow, but we can use the special drawing rights that we already have. But we drew down from that, so we are left with just a few resources. So at the African level, at that international level, there have been a discussion around issuing more in terms of the special drawing rights, particularly to address the issue of COVID-19. But again, I think the issue of governance is the major issue, because what we should not be pushing for is not just debt cancellation without putting in place frameworks. We know that Zambia got debt cancellation through the highly indebted poor initiative, countries initiative, HIPIC, but right now they are in debt distress. Mozambique got debt cancellation or debt relief under the highly indebted poor countries initiative as well before. But right now they are in debt distress. They have a debt conundrum from secret debts that were incurred by their government without knowing, in collusion with the private sector. So debt cancellation in itself is not the panacea. We need to look at our local governance issues and how we're putting in place an endogenous development plan that will ensure that we raise our resources domestically at the domestic level and be able to optimally use them and not misallocate them and not misuse them, as has been happening.
We need to continuously promote transparency in terms of allocation of the aid or support that comes through from development partners. But beyond that, I think the COVID-19 pandemic has taught many economies that as much as we are in a globalized, economy, or a globalized, global village, as it were. But it is very essential and critical that each and every economy is got to be self-sufficient as far as the provision of essential and public goods is concerned, so that at a time like this, the country could actually be better prepared in terms of ensuring that the population continued to access public goods without any interruption, and also the general population continues to access key basics at affordable prices. And we've seen price escalations, price instability, hyperinflationary pressures, as well as the shortage of foreign currency. Yes, we came through with quite a number of interventions that include, as a country, as an economy, coming up with the interbank market that was created to ensure efficient and equitable allocation and distribution of the little foreign currency that may be available at any given time. But you've seen also, on the other hand, the grey market, or some call it the black market, is continued to run amok. The rates there are running amok, and that has also powered a lot of domestic pressure on the policies that government may have tried to come up with to mitigate the impact of the COVID-19 pandemic.
There are a number of things. We need now seriously to look at issues of curbing illicit financial flows, the issues of tax havens, having more transparent systems that are accountable, and make sure that where wealth is created, that's where taxes should be paid in those jurisdictions, rather than the predominant scenario where companies want to weaken fiscal capabilities in areas where they are making that wealth and stashing it in tax havens or lower tax jurisdictions. So that is very important for Africa to be paid fairly for the extraction of resources. Then the second part of it is in terms of the stimulus package. I think basically, especially for Zimbabwe, it's a huge disaster. There are no resources. While the stimulus package is being announced, I think the fact that there is no money is likely to be more inflationary and giving more pressure on the citizens that are already strained in terms of the poor socio-economic conditions. Yeah.
We need a well-coordinated response. As Labour, we have asked government to set up a multi-sector stakeholder committee which will look at coordinating the response towards COVID-19 pandemic. Government has not been able to coordinate properly the civic society and to involve it in decision-making and in response mechanism. So many organizations are carrying out their own initiatives, but these are disjointed, they are not well coordinated. And if you look at the international community, for example, many of them who want to assist and who are assisting, for example, the EU, UK government, American government, the World Bank, IMF, those who are assisting, they are skeptical again about our government, and they are not willing to put their resources through government channels.
It's all about investing more in digital activism, making sure that we use our vibrantly social media tools, Twitter, Facebook, Instagram, whatever tools that are at the disposal, blogging, because we have realized that the power of social media, while many people may not be using social media, but in terms of challenging power, I think in the abuse of power is very, very, very powerful. We have seen like government now being forced to disclose more when citizens raise concern on some of the transactions that are happening.
So we need to move in a coordinated way. I think coordination of our response in this very shrinking civic space is very important. Lockdowns meant shrinking civic space for us. And going forward, we're going to be dealing with a very different citizenry. A citizenry that is atomized, that works in silos. Because of the lockdowns and social distancing, we are not going to know how to respond. There's a lot of inward looking when we are responding to disasters and to the issues of shrinking space for civic civil society organizations. So I think there is really need to reincarnate and to think and move away from the antiqued ways of doing things as civil society, where we do things as ZIMCOD, as ZCTU, as Crisis Coalition, as Zimbabwe Environmental Law Association, to coming together and having a coordinated voice, because the space is shrinking. And I think we can also enhance by really engaging and building on our community mechanisms that we have and the citizens' initiatives at the community levels. I think there is need for us to have presence in those spaces. Like I've said, it's going to be a different citizenry that just takes orders from the government, that has its human rights abused and curtailed for indefinite periods without the ability to challenge all that. So it's a different citizens that we're going to be dealing with. So we need to really enhance capacity to build on agency once again. And this agency can start from the individual level. And I think individual agency is very important. Once we build at the individual level, as of course we can do it even as institutions, then we come to a community, build community agency and move on like that. And I think the issue of solidarity is also important, and collaborations. This is important at the national level. We must be giving each other solidarity within this shrinking and closing civic space. And it also applies to the region. As a region, we got political independence by having the peoples of each nation, each country coming together and fighting colonialism. So there was solidarity. You would know that the soldiers in Zimbabwe can find habitation in Mozambique, for example. We would know that when apartheid is at its worst, people can run and come to Zimbabwe or go to Botswana or go to Zambia. You would know that when Namibia is not yet free, we are not yet free. So we have to talk about that kind of solidarity that brought about political independence. But we have discovered that political independence is not an end unto itself. We have to talk about economic independence. And this can also be achieved by us building on our solidarity as civil society organizations and coming together and knowing that political independence, yes, we got. Now we need economic independence. And that goes beyond just having us say we have economic independence. We must have freedoms. The economic independence must bring with it freedoms for the citizens. Freedoms, civil, political, social, economic freedoms, that and in the financial freedoms that each and every citizen of the SADC region must be enjoying. So it is a war. It is just as COVID was described as a war where each and every one of us is a soldier, because each and every one of us has to play a part. Because if you don't wash your hands, if you don't wear your mask, what it means is you're going to infect the next person. So in the COVID war, we are all the soldiers and we are all fighting this. The same applies. Each and every one of us must know that we have to play a part, and there is individual agency that we must build and leverage on to ensure that we have a free society where we enjoy all our freedoms at once simultaneously. We cannot be given in bits and pieces. We have to demand them as a whole, because a human being is a whole.
So for Africa, part of the challenge has been that many African countries inherited a colonial economic structure. And this colonial economic structure had its own massive challenge. It's different from the capitalism that we know from the West or in America, because it created a dual economy that are subsisting and operating alongside each other. So there is a massive informal economy, which in Zimbabwe contributes over 60.6% of the GDP, and also contributes 76% of jobs in this country, which are informal jobs. And there is a small sector, the formal sector, which is quite small in comparison to the informal sector. but which is given all the attention by state government policies and also developmental assistance. So much of the economic activity policies are targeted at the formal sector, but this is a sector that is only providing few jobs, a sector that is only providing less than 40% to the GDP. So one of the main response that is needed in Africa is to address the economic structural problem that we face, where many African countries have not taken care of the bigger economic sector, the informal sector. For example, if you look at the national responses across Africa, and especially in Zimbabwe, in South Africa, in Malawi or Zambia or Botswana, they've been focusing on opening up the economy from lockdowns on the formal sector, and they've generally neglected the informal sector. So if we continue to do that, we are not going to be able to address part of the challenges that we face, because for nations to be able to repay the debts that we owe other institutions and other countries, we also need to generate sufficient economic resources internally. And that entails developing the bigger sector, the informal sector. The second aspect that we also need to look at is that the informal sector, because it's neglected, it is got low productivity capacity, and it is also not modernized. So even as many people working there, as many working hours are put in the informal sector, the output is quite low, and it means that for as long as we have got a low output, we have got also low incomes for the people who are working in the informal sector.
I think we need not just to focus on COVID. Generally, it's about we look at how developed countries are being unfair to Africa. They developed by pillaging resources from Africa, and now strange that they are using that wealth gained to say Africa owes us. In fact, it should be the other way around. I mean, I find it very ridiculous, and I mean that we are having this conversation.
Much of Africans' debts and much of Zimbabweans' debts needs to a lot of analysis. Some of them are illegitimate debts, some are odious debts, and some are also clearly illegal debts. So there is also need for us to take account of what constitutes our debt. So there is need for debt audit and see what that debt has been used for. Currently with the Chinese, unlike other institutions like IMF, World Bank, who comes with conditions on their debts, the Chinese, much of them, they are secretive. They don't worry about governance. They just heap debts on the country and then expect to be repaid. We also need to look at the nature and the quality of the debt that we have if we are able to repay our debts. And then fourthly, if you look at our economies, because they've been mainly extractive economies, and much of our exports are in the extractive sector, it's in the minerals, raw minerals, and also raw agricultural produce. So one of the ways to address the African debts and the Zimbabwean debt situation is to carry out a structural transformation of the economy so that we develop our industry. Africa needs to industrialize, Zimbabwe must industrialize. It's only when we industrialize and move our resources from low productivity sector to high productive sectors in industry, in manufacturing, that we can generate more income for our economies. And finally, we are losing a lot of resources and a lot of income through illicit financial outflows. According to a recent report that was written by Action for Southern African, it shows that Africa is losing over over 8.8 billion Southern Africa through illicit financial outflows. And the Reserve Bank once pointed out that we are losing over 2 billion United States of American dollars through illicit financial outflows. If you go to our borders are porous. If you go around the country, every place where there are minerals, there is mining activity there. But there's nothing to show for Zimbabwe and for Africa. If you go to Chiadzwa, we had diamonds, alluvial diamonds, that did not require a lot of investment and a lot of equipment. You could literally pick diamonds on the surface. But again, if you go to those communities, there's nothing to show that we had diamonds. In fact, the communities' living standards have regressed ever since we got diamonds. So we need to have a holistic approach in terms of putting policies that ensures that we develop our economies. We also develop the big major sectors of the economy, the informal sector. We incentivize the small and medium enterprises. We incentivize the entrepreneurs in the informal sector. We also need to ensure that we increase productivity, and we also ensure that we increase incomes for workers. For example, in Zimbabwe, the majority of workers are earning around $20 US, around $30 US. You cannot expect such an economy to create more jobs, to create more domestic demand, and to also be productive and to be able to generate sufficient to pay its debts. So we are in a vicious cycle where there's low productivity, low incomes, high unemployment, and low GDP output. So we need low investments and also low savings. We need a holistic approach to address the crisis that we are facing if we are ever able to repay our debts. But we can't do it even if we have improved in terms of our economic capacity. Zimbabwe and many African countries require debt forgiveness, debt restructuring, and it requires us to be engaging the people we owe. And for those people we owe to understand that for as long as also Africa is not in good shape, Africa is in trouble economically and socially, the whole world is not well.
The aid dependency syndrome gripped the majority of developing countries in the periphery. If you look at the center periphery model, the center periphery theory, economic theory, and that is actually something that we should begin to do away with. Let's domesticate. Let's ensure that we localize, and let's ensure that we promote the efficient use and extraction of our own resources for the benefit of our own people, deal with corruption and promote transparency, because what we have seen is that in the absence of aid, most economies struggle. But we cannot have a situation where a country rich like Zimbabwe has got to sustain its economy, its social economic development on aid or on international assistance. We need to ensure that we use the domestic resources that are God-given, that we do have the land, we do have the minerals, we do have the human capital, and those actually can propel our economy going into the future. And it is also paramount that we, instead of direct aid, direct food handouts, we come up with some assistance in terms of coming up with sustainable projects that the people should actually, that empower the people, especially in the periphery, in the outlying areas, in the rural areas. And right now we have seen drought even affecting the urban constituencies. And that is an area that we need to deal with. Let's promote and create more opportunities, job creation, job opportunities, but more to that, we need to create opportunities for people to start their own businesses so that they can employ more people. And from that end, we've got an opportunity to grab, especially when you look at the rising informal sector at 70% of the of the economy. Let's turn them around and ensure that they formalize their business, they get the support that they require to do so. We choose persuasive interventions to ensure that it becomes interesting for those that are informal to formalize their businesses.